Okay. So in honor of COPD Awareness Month, I thought we could review bronchiectasis and COPD overlap syndrome. So for those of you who are tuning in from the COPD 360 social, welcome, and we're happy that you were able to join. Tim, you want to go to the next screen?
Yeah, let me just get that. There we go. You see my slide? Okay.
So today's objective is to learn what is the difference between bronchiectasis and COPD. What is bronchiectasis COPD overlap syndrome, also known as BCOS? How is BCOS diagnosed? Why is early detection important? Why does it matter? We're going to look at some testing, some management, and then some lifestyle changes that we can do. Go ahead and go to the next screen. So, how is bronchiectasis different from COPD? So, let's start by just talking about the basics. So, what is the difference between COPD and bronchiectasis? COPD is an umbrella term. So, an umbrella term for different airway diseases like chronic bronchitis and emphysema. COPD primarily involves narrowing of the airways. It's going to cause destroying of the alveoli or little sacs in the lungs. And it's going to cause a reduction of lung function and airflow obstruction. So things are going to block the air from getting in and out of the lungs. So essentially, a person has a difficulty time emptying their lungs of air. This is commonly caused by first and secondhand smoke. However, it's not only caused by that, it's also caused by air pollution, chemical fumes, dust, what you do for a living, different lung infections, genetic component of it called alpha 1 antitrypsin deficiency. And all of these things can lead to the development of COPD over time. Bronchiectasis, on the other hand, that primarily consists of airway widening and scarring and causes excessive mucus production and a difficulty in clearing the airways effectively. The most common cause of bronchiectasis is from the damage of the airways. So things that can cause damage would be alpha 1 antitrypsin, COPD, asthma, reoccurring infections or respiratory infections like pneumonia, whooping cough, fungal infections, aspiration, which is where food or liquid, saliva, even sometimes vomit, where that enters into the lungs. It's called aspiration. Other things would be immune disorders such as rheumatoid arthritis, and then something called GERD, which is your gastroesophageal reflux disease. And that's where the stomach contents can enter into the lungs. There are 40% of cases that are from unknown causes. But the thing that all of these have in common is inflammation. So the inflammation caused by these conditions, this is going to cause the bronchial tubes to become scarred, thickened, and widen. This is going to cause damage. It's going to loosen or slacken those airways, and it's going to interfere with the proper clearance of the mucus from the lungs. Because a person is unable to clear their lungs of that mucus, it causes a buildup or accumulation of inhaled particles like dust, bacteria, all of those different things. They get captured and they should be removed, but they kind of get captured and they build up in there. This buildup is going to lead to repeated lung infections and further damage and structural changes, making it even more difficult for a person to clear those airways. This is also known as the vicious cycle or vicious vortex, which we're going to get into in a minute. Go ahead on the next slide. So this is a picture from the bronchiectasis website, and you may have seen this, but I just wanted to point out that COPD affects over 30 million US adults and more than 250 million globally. Bronchiectasis affects an estimated 350 to 500,000 in the US and millions globally. So you can see that there's quite a difference in how many times COPD is diagnosed versus bronchiectasis. But I want to give you a second just to look at this image. Okay, go ahead and go to the next slide. So, understanding overlap syndrome. The term overlap syndrome refers to when two conditions actually coexist at the same time. So, bronchiectasis and COPD, they are two separate diseases that require two separate types of treatment. Because COPD and bronchiectasis share similar symptoms, so for example, we have your chronic cough with or without that mucus production, shortness of breath, and the risk of reoccurring exacerbations or flare ups from a new or persistent infection. A delay or missed diagnosis is very common in these patients because of the similar symptoms between the two. So sometimes it takes about 12 to 17 years to get someone diagnosed with this lung disease. An increased number of people with COPD are actually having CT scans as part of their diagnosis and follow up care, which is kind of good news because it's impacting the detection of any sort of airway wall changes that are commonly seen in bronchiectasis. This is actually leading to more people being diagnosed. The connection between bronchiectasis and COPD, it's not fully understood, and there still needs to be more studies. In fact, studies right now state that the prevalence of having this overlap syndrome range anywhere from 4 to 72%. Now, some of you might be thinking, oh my gosh, that's such a wide range. But what they did realize is that there is a correlation between the COPD stage and the development of bronchiectasis. So, for those of you who are unfamiliar with the stages, there's 4 stages of COPD: mild, moderate, severe, and very severe. And as you can see on the diagram to the left, underneath, you can see the little graph right there. You can see out of 855 people, you can see the breakdown between stages 1, 2, and 3, and 4. Stages 3 and 4 seeing a wider percentage of people having bronchiectasis later on in their COPD stage. Go ahead and go to the next slide. So, this image right here talks about that vicious vortex that we kind of talked or briefly discussed earlier. It explains how everything is really connected in the body and how bronchiectasis can develop from COPD over time, but how bronchiectasis can develop over time in general. So, when we think about this process, and if you think about COPD, although, again, there needs to be more research and more information about this, but when we're thinking about the process of COPD, COPD can make the lungs more sensitive. And then this leads to inflammation from different irritants. So we're talking like bleach, pine sol, Windex, all of those different things can cause irritants in lungs, and it can cause that type of swelling. Same thing with smoking, all those things. So this can cause the airway to become narrow, and then as the body's response to inflammation, it causes more mucus production. Then over time, this leads to infection. Then the infection causes more scarring, which, as you can see, how it enters into this vicious vortex or vicious cycle, everything leads to another, and it's going to increase the risk of getting bronchiectasis. Go ahead to the next slide. So this is just a picture that we put together to kind of put an image to the vicious vortex. So when we're looking at this and you see that someone gets sick with an infection, for example, maybe pneumonia, then they could get extra mucus from it. So we go down to the mucus pooling. Well, then that mucus pooling is going to make it so they have more inflammation. Then more inflammation is going to lead to more infection. Then more infection is going to lead to some structural changes in the wall. So this is just a good example of how this happens in the lungs, and just to put some images to it. So go ahead to the next slide. What are some symptoms that we need to look at that's going to warrant further investigation? So if you have COPD, what are some signs that we're going to need to investigate and see if somebody has bronchiectasis as well? So as we discussed earlier, a lot of these symptoms do overlap with COPD and bronchiectasis, but a chronic cough, so a persistent cough that produces lots of sputum, particularly sputum in large amounts that maybe has a changing color or consistency, an increased amount. So if there's an upsurge in that mucus production or if there's a change in sputum characteristics, so you'll hear something called purulent sputum, and that would be like an opaque or yellow, green, off white. Those are going to be indications of infection. Frequent respiratory infections. So, frequent respiratory infections like bronchitis or pneumonia, especially if someone is sick about 2 to 3 times a year. And then coughing up blood. No amount of blood or blood streaked sputum is typical for a stable COPD patient. And it should be prompted that they seek immediate investigation of this for some sort of bacterial infection or inflammation, structural wall changes in the lungs, and then unexpected weight loss. So the body requires more energy because of the increased work of breathing and because of chronic inflammation and infection. So if there is a loss of weight unintentionally, that also should be something that someone should seek out medical attention for. Go ahead to the next slide. So why does early detection matter? They are associated with, or overlap is associated with an increased disease severity. So when bronchiectasis and COPD coexist at the same time, it can lead to a more severe disease course. And patients with both conditions tend to experience more frequent exacerbations. They have poor lung function and a higher risk of getting reoccurring respiratory infections or even respiratory failure. Early diagnosis allows for a more tailored treatment approach. So, understanding that each disease needs their own treatment, each disease, when they get that treatment, it could be like medications and therapies and lifestyle changes. But when we look at these as two separate components, it's going to allow for a better tailored treatment approach. And then by understanding both of these conditions, practitioners or providers, they're going to be able to help manage these symptoms early. They're going to help to reduce flare ups and they're going to help to slow the progression of COPD as well as bronchiectasis and then overall improving outcomes. Next slide. So, how do healthcare providers diagnose bronchiectasis and COPD overlap syndrome? So, it is more common for someone to have COPD and develop bronchiectasis than vice versa. So it's not as common for someone to have bronchiectasis and develop COPD. So with that, clinical evaluation. So if you are questioning bronchiectasis, it's important to communicate this with the provider. They will ask questions to understand your symptoms as well as what your family history is and potential risks. A high resolution CT scan, this is going to be the gold standard. It's going to help to detect any sort of fine changes in those bronchial walls and ultimately diagnose. Pulmonary function test is another common one, and this is going to just provide some objective data to see what degree of respiratory impairment there is. Go ahead to the next slide. So, bronchiectasis management options. There's no straightforward management strategies for overlap syndrome. Treatment is beneficial. Treatment that is beneficial with COPD might not be beneficial for people who have bronchiectasis and vice versa. So, making sure that we are treating the underlying cause. What caused the progression of COPD? Why Did this person develop bronchiectasis? What was going on? Did they have frequent infections? Or maybe they're not as mobile. Maybe their COPD isn't properly managed. Lots of different things go into treating the underlying cause. Other things that can be used is medications, bronchodilators and steroids, antibiotics, and those things of that nature. And then airway clearance techniques and devices. So things like a flutter, an OPEP, where it does the vibration, or maybe even a vest. And then, of course, looking at how can I help to get my quality of life back? How can I help to learn more about my disease and stay active and help to kind of push the reset button as going to pulmonary rehab? Go ahead to the next page. So, another way is through active cycle breathing or breathing techniques. So, breathing techniques are going to be designed to help move mucus from deep in the lungs, and it's going to make it easier to cough that mucus out. So, again, with bronchiectasis having remodeling of the airways and it makes them looser or slackened and harder to get out that mucus, we can use different tools like autogenic drainage, which involves inhaling at different lung volumes and adjusting exhalation or the breath out to move mucus. Active cycle breathing, which is going to combine controlled breathing and then chest expansion or thoracic expansion, and then having a forced exhale. And then huff cough. A huff cough is a really great tool to have a controlled cough. It's going to use the muscles of your back, your stomach, your position, and the strength of your diaphragm. All of these are going to be good to help force out quick exhalation to force out mucus. But the most important to treatment or for treatment for bronchiectasis is making sure that you are adhering to a plan. This is really important because a treatment plan is only as effective as a person's effort. So if you have great effort, you're going to get more out of your treatment. If you have adherence, meaning that you're doing what you're supposed to or doing what's recommended, and you're trying to work on that every day, that's going to help to be preventative. It's going to help to clear the lungs so things can't build up. Go ahead to the next slide. So, some lifestyle changes. With the lifestyle changes, staying active, just a really good rule of thumb, staying active 30 minutes per day is what is really recommended. But we know that that can be hard for some people. So, just setting small goals and working your way up. Exercise can come in all different shapes and sizes. Exercise could be sitting on a chair and grabbing some cans of soup and doing some arm workouts, or looking on the internet to see if there's some breathing exercises you can do. Or it could be going for a walk around the block. So, exercise comes in all different shapes and sizes. But again, adherence or consistency is going to be key. Infection prevention. It's important to avoid places or situations that infections like to spread, and avoid maximizing exposure. Making sure that you're washing your hands, getting the vaccines that are recommended, and avoiding sick. Now, I know it's going to be the holiday season, and that can be hard, but talking with your family, having open communication, and saying, if somebody is sick, can you please stay home? And if someone's saying that they don't want to stay home, see what other options there are, like wearing a mask, maybe sitting at a different table when you're eating, things like that, just to help protect yourself. Making sure that there's a healthy diet. So, a healthy diet in things like fruits and vegetables, lean proteins, whole grains, those are all going to help the body fight infection and inflammation. Quitting smoking. Quitting smoking, like firsthand smoking, secondhand smoking, vaping, all of those are known to worsen the symptoms and progression. And then avoid irritants. So, irritants are not only smoke, but it's things like air pollution, paying attention to the news. What's the air quality index? Paying attention to, are there wildfires around? So, looking at what are some irritants that I can take out of my life to help protect the lungs, avoiding chemical fumes, dust, things of that nature, maybe wearing a mask while you're mowing the lawn, and then maintaining a healthy weight. So this goes along with healthy diet as well, but nutrition often gets overlooked. And that's because changes in weight are associated with reduced exercise capabilities. They're going to being malnourished or having a low weight can cause decrease in energy. It can cause muscle loss, and again, most people who have bronchiectasis are underweight. So working with a dietitian to help avoid malnutrition. Malnutrition is a huge contributor in increasing severities or exacerbations. It's going to decrease. Oh, am I changing that?
Nope,
I
sorry,
thought I was.
my screen took over.
Oh,
Sorry. Nope, I'm back.
I
Can
thought I was doing that.
Nope. Sorry, everybody.
So malnutrition is a huge contributing factor to increasing exacerbation severities. It's going to decrease wound healing. It's going to increase the risk of infection, and it's going to impair the immune system response, and then ultimately delay recovery time and poor outcomes. So talking with a dietitian is a really good way to see what they would recommend, what foods to cut out, what foods to add, and when you're having an exacerbation or flare up, then what things can you do to help your body to be able to get what it needs to heal faster? And then the last one is prioritizing sleep. Sleep is essential for our physical well being and for our mental health. Go ahead to the next slide. So these are some resources from the Bronchiectasis and NTM 360, and you can go ahead and scan them with your phone. Otherwise, they will be entered into the chat, so you can go ahead and visit those sites. But I wanted to point out the last one on this list, which you see like the three little segments there. This is a symptom tracker. So for people who like to track their symptoms, like to see how they're doing overall, and see if there's any trends in your activity or how you're doing your airway clearance, this tool is going to help you to track it. And if you notice that there's a deviation, then we might need to go ahead and seek other attention. Or if you want to go to the next slide real quick, refer to the bronchiectasis action plan. So the bronchiectasis action plan, this is a really great tool too. This one is going to talk about what your symptoms are and what to do about them, or when we should start seeking other medical advice. And the symptom tracker is in this sheet here, if you scan that barcode on this. But if you go to the website under the Learn More and the Downloads library, you'll be able to access this and download it, print it, take it with you to your doctor, and you can even talk to them about um, what you're currently doing, what's worked, what didn't work. There's lots of space on there, even for goals. So, again, this is a new tool and it's a great way to get more control over what's happening and what to do when things go and get worse. Okay, so now let's go ahead and get into our questions.